The VNA makes a difference in the community by providing critical public health access to all individuals in both communities that we serve. We break down barriers, we look for gaps in the community to make sure that all residents have the same opportunities to a high quality healthcare access.
Dubuque's really our only urban area that we serve, and our service area is all the way from Dubuque and Delaware to the Minnesota border. The further out you go in rural Iowa, the more difficult it becomes. And so a lot of times, we're the front line that are coming into contact with those most in need.
We provide life-saving health services that others may not be able to access. Without our services, we would not have as many children immunized, lead tested. We serve the elderly in their homes to keep them there longer rather than going into long-term care. All of our services are done with the idea of improving access to individuals that cannot access it other places.
We have so many programs that we offer and so many types of patients that we serve, but specifically to my area, mother-baby, labor and delivery, there's an area of people that are underserved because they don't have means to get in to see a physician right away. They don't know how to go about that if they've just moved to this community or they're lower socioeconomic. And we kind of fill that void.
I had no idea where to even begin for breastfeeding or insurance or even like delivery and all the appointments leading up to the delivery they helped with and what to expect. I was a first-time mom and I really wanted to breastfeed and I was having a lot of trouble with it, and they gave me a bunch of resources that made it a lot easier.
It's important to have the services provided by the VNA in this community because without our services, many individuals would go without. They would not have access to health providers, insurance, and some of the critical care that they cannot receive elsewhere.
So we kind of work on the family as a whole, whatever the family needs, and we work with the parents and the children. So if the parents have issues as well, need help finding a therapist or they need help with budgeting, we try to help them with that as well because we feel like it helps the whole family with the needs that they have.
I think some of our most impactful programs are the programs that are kind of gap filling, in our community, one of which is our payee program. So a representative payee is somebody who manages money on behalf of an individual who's enrolled in Social Security. A lot of times these individuals are mandated by Social Security because they're unable, for whatever reason, to manage their own funds.
If I had my money right now, and if it didn't have the VNA, I would be lost. I have all these bills, gas bill, electricity, and the headaches. Well, I don't have these headaches now, thanks to the VNA. I feel very strongly about these people because they've been really good to me, and that's the honest to God truth.
The team in the VNA are amazing. We could not do what we do without them. They are hardworking, resilient, they are dedicated, they show compassion and care to all individuals that walk through the doors, and I think that is my favorite part of the VNA.
We are a team of men and women that care about Dubuque as a community, want to see people happy and healthy and be able to be self-sustainable and function in society and take care of their families and know that they have the tools and the support to do it.